So this young lady was brave enough to share her experience with Botox gone wrong. What happened was she got treated for the lines between her brows, and about a week later, she noticed she had a drooping of her eyelid here. So why does this happen? Most likely what happened is that the injection point for this part of the brow was too far off to the side, and it migrated into the muscle that is responsible for elevating the upper eyelid. So as that muscle becomes weakened, the upper eyelid cannot raise, so it droops. A couple other interesting things to note about this is if you look at the eyebrow on the affected side, it's actually raised when you compare it to the other side. And that's because that part of the forehead is actually working to compensate for the droopy eyelid and trying to raise it. The other interesting thing to note is if you look at the eye on the unaffected side, the upper eyelid on that side is actually hyper functioning and working overtime to try and compensate for the droopy lid on the weakened side. So that's why it's over contracted and you can see more of the white part of the eyeball on that side. So what's the treatment for this? There's really not much you can do. There are some eye drops that may help minimally improve the appearance of the droopy eyelid, but really what it takes is time. Fortunately, once the Botox completely wears off, things will go back to being completely normal. The take-home message from this video is the importance of finding someone who is very experienced in doing Botox injections and has an expertise knowledge of anatomy and injection technique. These complications can happen in anyone's hands, but the experts really take multiple safeguards to minimize the risk of it happening.